Hey guys, this is Manu, physical therapist and Ayurveda herbalist. Wanted to share a quick video on treatment of hamstring strain, some soft tissue mobilization techniques to break up scar tissue and adhesions. Hamstring strains are quite common, and your hamstrings are it's a group of muscles is made up of your on the inside you have your semimembranosus and tendinosus. On the outside, you have your bicep femoris. So, of course, the strain could strain or pull, which is quite common in athletic activities, can be anywhere along the length of the muscle belly, or further up at the attachment site at the ischial tuberosity. But we're going to talk more about the strain along the muscle belly. So, so you'll have to palpate and figure out where the strain is along the muscle belly. So movements that either stretch the hamstring muscle, right, or contract the hamstring muscle are going to be painful. And these tend to become often into recurrent problems where it seems like it's getting better, but then the person continues to strain that tissue or irritate that tissue, which causes pain. And it's often because due to the initial injury, if there are micro tears in the fibers, it ends up getting fibrotic changes, thickening, or adhesions that form in the injured area. So around that area, things could be moving well and possibly strong, but that area becomes the weak point. So working at improving that mobility, breaking down the scar tissue, so the whole tissue moves well. There's good tissue glide between multiple layers. Allows that tissue not only to heal, but also to start working on strengthening, to strengthen that tissue again. So those recurrent injuries, after a while, they might form more scarring and thickening and weakening the whole muscle. Okay, so one of the things we want to do, of course, is we want to find out first where along the belly you're having the problem. So let's say if we say that it's, we're going to pick just a spot in the middle of the muscle belly, right? So the muscle fibers are running up and down. So you want to, once you find those tender and thickened areas, you want to work at doing cross-friction massage. You want to work at breaking down the thickening. So muscles going this way, I am going across the fibers, not just on the skin, but I'm also putting a little pressure and I'm going back and forth. And you might find it's not just across this way, it might be at diagonals or different angles. You might find restrictions or thickening along that tissue. So I want to find that spot, put a little pressure and work on cross-friction work. So I can use my thumb, I can use knuckles to get a wider area. I can use my elbow where I can put a little pressure here and I can go back and forth. Now I put the muscle, when I'm holding this here, I put it in a slightly slack position. It's not as stretched as when the leg comes down. So sometimes that's more comfortable when it's really irritated. I can put it in a slightly slack position and I can get in these positions and I can go across fibers in various directions. Apply pressure with my elbow, go back and forth, back and forth. It's a little, usually quite tender, it's not very comfortable, but very effective. So along different angles, different planes, I want to work at breaking down that tissue, but then also lengthwise too. So I might want to work at massaging in upwards and downwards direction also, so I hit it from various angles. After you're done with your massage part, or especially cross-friction massage, so spend about 5 to 10 minutes. That's what most of the person is going to tolerate. I haven't tolerate more than that. Then I want to work at doing a little bit of tack and stretch. So I tack that tissue down and I stretch, tack and stretch. It's also a bit of a pump massage technique to just globally stretch out various tissues and from different angles. So I'm tacking it down, I'm pulling the leg down, so I'm stretching that tissue from different angles and also improving circulation, just getting things moving a bit and just stretching out tissue from various angles. So I'm not applying too much pressure, so a little bit of pressure, upward direction, tack and stretch, tack and stretch, tack and stretch. Usually this part is quite comfortable and people like this part and it doesn't cause as many problems. So quite an effective technique to get rid of those problems. And I would do, starting off, you probably want to do that every other day, or even take 2 days in between. Or to get sore after the treatment, you want to give it a day or two to kind of settle down before you do the technique again. Okay, and after some time, you'll find that it won't get as sore and it starts to move better, and then you can start focusing more on the strengthening aspect of things, as well as doing more other stretching or mobility exercises. I hope you found that helpful. Make sure you check out the site. We have our program on it now. It's been live. Build Better Knees, and I think it can really help a lot of you with various knee injuries and problems. Subscribe to the channel and leave a comment. Thanks.